Hi, I'm Josh Elston, and today we're talking about what is lipedema and also liposuction for lipedema. Before we talk about any type of treatment, it's important to understand what lipedema is. So the best way that I've heard it described is it's like a bank that allows only deposits and it never allows withdrawals. So it's a loose connective tissue disorder that affects primarily women and mostly in the areas of the legs, the arms, the thighs, and the hips where you store fat. So with lipedema, patients will store fat and it's very, very hard for them to lose it, even if they have diet, exercise like crazy, if they have weight loss surgery, they still will retain fat in those areas. So patients will come to me, and even after they've tried a lot of conservative measures like compression, manual lymphatic drainage, they still have these areas of fatty accumulation that they can't get rid of. And the best treatment for that long term is liposuction. So let's talk about what causes lipedema. We know that there's some genetic component to it, and then there's also a hormonal component to it. A lot of people will see it in multiple members of their family, particularly as they grow up, they may start to realize that their family is big on bottom, or they've got kind of bigger legs or bigger arms, and they just assume that that's the body type that their family has. Really, there's probably some underlying genetic component that we don't completely understand yet, but what we also understand is that there's some hormonal quality to it as well. Most people will have proliferation of the fat in their legs, thighs, hips, or arms around hormonal shifts. So most often is puberty, pregnancy, and then perimenopausal state. So telltale lymphedema symptoms for most people, and it can vary person to person, but what most people will start to notice is that at a younger age, usually around puberty, they'll start to notice that their body's changing in ways that their peers don't change in. So some women will start to see that they have swelling around their calves and ankles, which people call cankles. They'll start to notice that at an early age, and even if they don't understand exactly what it is, they understand that something is different about themselves that they don't see in anyone around them. Some other early telltale signs of lipedema could be kind of fatty accumulation around the kneecap where you have a shelf of fat that hangs over, or some people will start to notice it first in their arms where they feel like they're very, very skinny, but their upper arms are disproportionately larger. Is lipedema different from cellulite, or is it different from just being obese and overweight? So it's kind of like a yes and no sort of thing. So they can coexist together. So it's important to distinguish what cellulite is. So cellulite is like a dimpling of the skin, usually where the skin is attached to deeper parts of the connective tissue. That can manifest as some of the fat bulging around those areas of adhesion or tightness. So you can have cellulite independent of having lipedema, but if you have lipedema, you can also have cellulite. Some of when patients have lipedema and it gets more severe, they will start to get dimpling or pebbling of the skin, and that can be confused as cellulite when really it's lipedema presenting as something that people understand as cellulite. Similarly with obesity, you can be obese and also have lipedema, or you can be lipedema and also not be obese. So you can be overweight and have lipedema, and it can be very hard to distinguish that because people just assume that you're big everywhere. But there are some patients that have a normal body weight that also have disproportionate fatty accumulation, and that is one of the telltale signs of lipedema. So available options for lipedema treatment, I would divide into non-surgical and surgical. And there's usually kind of a marrying of both of them when you're talking about addressing someone with lipedema. So first off, you want to make sure that they're optimized non-surgically before you do any type of surgical treatment. So non-surgical options would be compression, which help to get fluid and lymphatic swelling out of the extremities before you do any type of surgery. That can reduce limb circumference, it can make things feel less uncomfortable and a little bit less swollen. Things like manual lymphatic drainage, where you're helping to work some of the lymphatic fluid out of the extremities, can also be very helpful. And then some people find benefits from things like lymphatic pumps or vibration plates that they're on. But for the most part, I think that when you're talking to a surgeon, they're typically going to recommend surgical therapy for a problem if there's a solution that way. So surgical therapy for lipedema is most often liposuction. Unless you're very, very advanced and you're talking about someone that's progressed to a stage 4 where they have lymphedema on top of their current lipedema, most of the time you're talking about liposuction, which is done similarly to how you would do liposuction for like a cosmetic tummy case or arm liposuction. It's done a little bit differently because the fat storage patterns are different for lipedema, but for the most part, the surgical therapy is liposuction. I get that question a lot: what type of liposuction is best for lipedema, or is there a type of lymphatic sparing liposuction? So the different types of liposuction, the oldest kind is just where you use a cannula, it's hooked up to suction, and it's just you're moving and mechanically removing fat. That type has really fallen out of favor. It tends to be more fatiguing for the surgeon, and it can be slightly more traumatic for the patient. What I prefer to use is called PAL, or power assisted liposuction, and that basically hooks up the liposuction cannula to a machine, and it helps to ease the fatigue on my arm when we're doing a surgery for a couple hours, but it can also help me to penetrate into firm fatty tissues and break up adhesions, so I can do a more even and complete removal of fat. There's other types like ultrasound assisted liposuction or vasor liposuction, and those can also be helpful for patients with lipedema. I just don't use those in my practice. So specifically also talking about which type is the best to prevent long-term problems. People have concerns about lymphatic sparing liposuction, and really all liposuction is lymphatic sparing to some degree. You're not removing lymph nodes when you're doing liposuction, you're only removing fat in the subcutaneous layer. And everyone, despite whether they have lipedema or not, when you have liposuction, will have some degree of lymphatic disruption. So the idea that you can do a technique in certain longitudinal or axial patterns to prevent disruption of the lymphatics is just really not true. And it is a little bit of marketing, I think, in my mind. I think that most gentle liposuction cases are going to preserve the lymphatics, and you'll have some temporary swelling after surgery, but within a few weeks, that swelling should begin to significantly resolve. So in terms of, does this recur, or will lipedema come back after liposuction? Well, I haven't been doing it for 20 years, so I don't have the benefit of time on my side, but from all the reports that are out in the literature, it does show that if you don't have significant hormonal changes or significant weight gain, that it should remain off for at least 10 to 12 years. That's about the furthest data out that I've seen. Anecdotally, I have colleagues that have been doing this for over 20 years, and they've got really good results with their patients over the long term as well. So it's challenging to get lipedema liposuction covered by insurance, but it's not impossible. Every patient that gets their surgery covered makes it easier for the next patient to get their surgery covered. It can be very challenging though. You may have to do a lot of conservative measures and quote unquote jump through hoops for a while for the insurance company to make sure you've exhausted all conservative measures. For a surgeon, this can be really frustrating because you can see someone and understand that they're probably not going to get better without liposuction, which is the definitive treatment, but they may need to do some more of these conservative measures, physical therapy, lymphatic drainage, compression, for an extended period of time before their insurance approves it. So once they do get approval, then it's also a matter of making sure that you're doing enough surgery so that it doesn't recur and that the patient's going to get the benefits as well. Some insurance providers are better at approving lipedema surgery than others. We try to get approval before we do any surgery because we don't want the patient to get burned on the back end. So some practices will accept money up front from the patient and tell them that they'll submit it and we'll get it approved by insurance. And you just don't know that. It's not a guaranteed thing. So it can lead to some pretty unsatisfying conversations when you've taken someone's money up front, promise them some result, and then if their insurance company doesn't provide the remuneration for the surgery, it can really sour things. So we don't engage in that. We don't do a surgery for someone unless we know for sure definitively that their insurance company is going to pay for it. And then it's a reasonable amount that the patient isn't going to have to pay some balance to us because their insurance provider doesn't want to pay the full cost of surgery. In terms of cost for lipedema liposuction, I try to put things together in packages of common areas of concern. So for most people, it's either the legs and the knees, or the thighs and the knees, or it's their arms. So I do package deals for all those, and they're all listed on the website. Obviously, if you're watching this video at one time versus another, the prices may change, but they should be current for whenever you're inquiring about the surgery. I believe price transparency is incredibly important because I don't want people to come in and for price to be a barrier for why they're not getting their treatment. If you don't want to do a package deal, there's also surgical options by area. Obviously, it gets a little bit more expensive the more areas that you do, but there is a base level, which is the first area, and then each area after that is a little bit cheaper than the first area. But all of that information is available on the website. We also try to be very transparent on social media about what our prices are, because I don't believe in having someone come in and they really like me and they want to do the surgery and they're really excited about it, and they find out that cost is going to be an issue and they're really let down by that. So if you're interested in talking about liposuction for lipedema, or if you think you know someone that has lipedema, I would encourage you to visit our website at www.elston.clinic and check out our page for lipedema. We do free virtual consults where we talk with people all the time about lipedema liposuction and to find out if someone's going to be a good enough fit or not. You don't have to be in the Washington State area. We see patients from out of state all the time, and we've got a good plan together for if you are traveling from out of state to come seek treatment. Some areas there aren't any physicians that do liposuction treatment for lipedema for hundreds of miles, and it's important that you find someone that works out well with you, and we're excited to meet you, and we hope to help you on your journey.